Hi, welcome to my presentation titled Community Health Education Project Coronary Artery Disease Prevention in Adults aged 50 to 65 years old who reside within 90275 Ranchos Palo Verdes, California. This project seeks to prevent coronary artery disease in adults 50 to 65 years old living in Rancho Palos Verdes, California. It is known that CAD is a health concern in the region. The data point I found was that in Los Angeles, 45.4% of adults 65 and over had 2 or more risk factors for heart disease and stroke, based on data collected by the Los Angeles County Department of Public Health between 2011 and 2012. This is my web of causality. It is an example of 2 strengths in the community that support learning how to prevent coronary artery disease in this age group. And then on the right are 2 examples of barriers in the community that make it more difficult to access and understand this information. So we have a high level of educational attainment, and we have abundant local senior resources. These are strengths that we can tap into to help reach more people in the area specifically. On the right, limited accessibility for lower income seniors. There are still people in the community who can't afford things and maybe can't have the same access. And then there's digital divide and technology access. In this age group, people may have less computer savvy, so we would want to design our program to not alienate people who aren't great with computers. This slide simply describes the goal of the project in the form of a PICO question, and that question would be, in adult participants in a nurse-led lifestyle education program, does an 8-week nurse-led lifestyle education program versus no formal lifestyle education intervention lead to 70% of the participants achieving a score of 80% or higher on a post-test by January 15, 2026. The content in the educational program that I propose consists of 3 content areas. 1, pathophysiology, 2, primary prevention, and 3, personal risk factors. Strategy for engagement includes interactive case studies and group problem solving. The purpose of this is to present scenarios of an adult the same age as the people in the group with similar problems that people in the group might be presented with, like high blood pressure, high BMI, and ask them to work together to diagnose modifiable risk behaviors and develop a 1-week action plan for primary prevention. And the rationale for this is that it is age appropriate for these adults, and it addresses the fact that they do have a high level of education. They become active participants. They become engaged with the exercise. This slide speaks to the timeline involved in developing the program, all the way through to teaching the program and then assessing the knowledge that was gained at the end of the program. So planning would go for 4 weeks, October 1 through October 31st. It would involve finalizing content, printing supplies, marketing the program, securing a meeting location. Implementation would go for 8 weeks. The actual teaching evaluation would go for 2.5 months, where we would be administering the tests. And finally, the assessment would happen January 1st through 15th. So leveraging a strength. As I've said, the community has a high level of educational attainment. Therefore, we would create engaging, interactive, discussion-based sessions that would appeal to people. Decreasing a barrier, the potential for technology being difficult to attain. So rather than have things be entirely computer-based, we would have more face-to-face interaction that might be more accessible to people who aren't so comfortable with computers.